So now we're going to talk about how we investigate your lame horse or your poorly performing horse. So once we've done our initial clinical examination, we need to then decide which investigatory tools we use to try and define exactly what is going on. So if there's nothing obvious on the clinical examination, so for example there's no obvious fetlock swelling that tells us it's the fetlock, then we'll start off doing some regional nerve blocks and some joint blocks. This means injecting local anaesthetic around nerves that supply a particular area of the horse, for example around the nerves that supply the foot, or injecting local anaesthetic directly into the joint, such as a fetlock joint. Trotting your horse up after this local anaesthetic has had enough time to have an effect to see whether the lameness has improved or not. If it's improved, then we can then do further investigations and imaging in order to define what the cause of that lameness is. If it hasn't improved, then we can do further nerve blocks and joint blocks up the leg. So once we've got our defined area of lameness, where that lameness is coming from, the next port of call is to do some X-rays. So this allows us to assess the bony structures within that region. We can't assess the soft tissues very much on the X-rays, so we're really just concentrating on looking at those bones. So we can see conditions such as osteoarthritis, bone chips as in OCD, bone cysts, fractures, etc. We can't assess the cartilage in the joints, but we do get a good idea of what that bony architecture can look like. So ultrasonography is generally the next modality that we would use, and this allows us to assess the soft tissue structures of the horse. So say for example if we're concentrating on the limbs, we can then have a good look at the tendons or ligaments if that's where we think the problem is, and we're looking for changes in size, changes in the ultrasonographical architecture, changes in the borders of those structures in order to see how much damage there actually is. We can also assess the joints and look for any joint effusion or joint swelling, look at the joint margins and see whether there's any bony irregularity that might be there as well. And we can also assess the bone margins as well. If there's been, say, a wound or a traumatic history, we can see whether there's been any injury to the surface of the bone as well. Magnetic resonance imaging, or MRI, is a really useful tool and has been around for many years now. We've got a standing system here where we can perform an MRI on your horse under standing sedation, and we can include the feet, fetlock, suspensory ligaments, and up to the carpus or the knee, and up to the hock region. And the MRI allows us to look at the bony structures and the soft tissue structures in a lot more detail compared to X-rays and ultrasound, and gives us a much more complete picture of what of the abnormalities that your horse may have. We may elect to perform a bone scan on your horse. This is sometimes called nuclear or gamma scintigraphy, and essentially this is when we inject a radioactive substance into the jugular vein, and this radioactive substance attaches itself to bone, particularly new bone formation, areas of new bone formation, and it's a very sensitive way of picking up bony pathology. So it's very good for picking up stress fractures, which is very useful in the racehorses, but it's also a very good way of assessing the neck, back and pelvic areas as well, which are very difficult to image with using X-ray and ultrasound. So it's a very useful imaging modality, particularly for racehorses, or particularly for horses that present with an acute lameness, or poorly performing horses as well. So once we've got all this information from the clinical examination, our history, dynamic examination, X-rays, ultrasound, any further imaging modalities that we've needed to use, we can then formulate a treatment plan for the diagnosis that your horse has. This allows us to give you a detailed assessment of the treatment plan and also a detailed idea of what the prognosis might be for your horse to be able to return back to the previous level of exercise.